Welcome to the Eat Better, Move Better, Live Better podcast presented by Flourish with Tracy, where we'll dive into the realms of holistic wellness, plant-based nutrition, yoga, and self-care to help you live your best life. Tune in every Monday, Wednesday, and Saturday at 8 a.m. Eastern for our special segments. Meditation Monday, start your week with mindfulness. Wellness Wednesdays, get the midweek boost you need. Sadhana Saturdays, dedicate weekends to personal growth. Join us as we explore and discuss all things to eat better, move better, and live better. Welcome. I'd like to discuss two powerful modalities. Each have been used for thousands of years to restore balance, restore blockages, and support the body's natural healing abilities. Today we'll explore how they work, their similarities, differences, benefits, contraindications, and what typical sessions look like, and how to identify a safe practitioner. Talking about the rich, deeply healing world of acupuncture and acupressure. Before we begin, this presentation is for educational purposes only and not intended to diagnose, treat, or cure any medical condition. As always, please consult your licensed medical provider or practitioner before starting any new therapy, especially if you have any pre-existing health conditions, are pregnant, or taking medications. Let's begin. Both acupressure and acupuncture come from the same traditional foundation. TCM is traditional Chinese medicine. According to TCM, the human body is powered by the vital life force called Qi. Qi moves through energetic pathways called meridians. They run like highways throughout the body. When Qi flows smoothly, we experience harmony, vitality, and physical, emotional, and mental well-being. When our Qi becomes blocked, deficient, or stagnant, or even excessive, then dis-ease or symptoms begin to appear. It may look like tension, pain, chronic illness, insomnia, issues with our digestion, anxiety, or a hormonal imbalance. Traditional Chinese medicine seeks to restore balance by encouraging Qi to flow freely. And the two most common tools for doing this is acupuncture and acupressure. Acupuncture is a therapeutic technique in which the practitioner inserts a very fine, sterile, single-use needle into specific points on the body. And these points correspond to the meridians are chosen based on your unique pattern of imbalance. There's a modern misconception that acupuncture is painful. It's not the case, as these needles are actually extremely very thin. They are thinner than a hypodermic needle, which is used for injections. Most people feel little to no pain or discomfort. Common sensations may include tingling, warmth, heaviness, or a dull ache. And trained practitioners may enhance the treatment by adding gentle electrical stimulation, cupping, or heat therapy, or using a gua sha tool, which is a tool that helps to move the energy and stimulate the limbs. Acupuncture is commonly used to treat chronic pain, stress, migraines, digestive problems, allergies, sometimes fertility, emotional imbalance, and overall well-being. Acupressure is a practice that does not involve the needles. It uses pressure, typically with the hands, fingers, and elbows, or even specialized tools to stimulate the very same points or meridians that are used in acupuncture. Because acupressure does not involve needles, it is suitable for those who may be sensitive to needles. It is also suitable as a self-care practice that can be performed by a visiting practitioner in the comfort of your home. And it also supports conditions like nausea, headache, anxiety, tension in the body and neck, insomnia, and menstrual pain. Acupressure can also be administered as part of a massage therapy session or as a standalone for traditional Chinese medicine modality. It can be gentle or firm depending on your therapeutic goal. Many find it extremely relaxing. The similarities is that they each work with the same meridian system. They each stimulate the same acupoints. They each aim to release energetic blockages to support physical, emotional, and mental balance. They each can be used to treat acute symptoms and chronic patterns. They each focus on whole body healing rather than addressing just the symptoms alone. And they each promote relaxation, circulation, and response for the parasympathetic nervous system. In essence, they are two versions of the very same medicine. One uses needles, the other uses touch. And outside of this, other differences between acupuncture and acupressure is that they differ in the level of intensity. Acupuncture typically reaches the deeper layers of tissue and energy. Acupressure remains surface level. The difference is also in training and licensing. Acupuncture requires a formal education, board exams, and state licensure. Acupressure training can vary widely based on a few hours or a full certification program. There's also a difference within the tools that are used. Acupuncture uses the needles, acupressure uses hands or tools. And the strength of the therapeutic effect may differ, as acupuncture may provide a stronger or faster results for certain conditions, especially chronic pain, nerve concerns, or systemic imbalances, as it's a deeper tissue engagement. And then there's also a difference with accessibility. Acupuncture should be done in a professional medical environment, an office, a practitioner suite with a licensed Chinese medicine practitioner. Acupressure is more easily accessible as it can be learned for at-home self-care between professional sessions. The trained acupressure professional can add it to your massage session, as many licensed massage therapists incorporate acupressure into their deep tissue therapeutic sessions. And then there's also therapists who specialize in Asian bodywork therapy, and this is deeply rooted in the meridian system in the form of acupressure. You can also access acupressure at a wellness center or holistic healing studio, as well as a chiropractor or a Ayurvedic wellness center or reflexology clinic. So there's several places that you can receive an acupressure session. Hospitals and integrative medicine programs offer both acupressure and acupuncture, as their focus is on pain management and body work, and these are done by licensed medical professionals. In addition to the physical and mental and emotional benefits of both acupuncture and acupressure, there are also holistic benefits. It will balance the meridian system. It supports your organ health and flow of qi. It enhances vitality and energy. It restores mind and body harmony, encouraging inner stillness. And it complements your massage, yoga, meditation, Reiki, or any other healing practice. There are a few things to be aware of. It is generally safe, both acupuncture and acupressure, when it's performed by trained professionals. Be of concern, however, if you have an active infection at the site, an open wound or skin lesions, if you have severe bleeding disorder, or if you've had recent surgery in a specific area, or if you're in certain stages of pregnancy, you'd like to avoid acupressure or acupuncture unless you're working with an experienced practitioner. Specifically, you want to avoid acupuncture, insertion of a needle, if you have uncontrolled bleeding disorders, if you're taking high doses of blood thinners, if you have a phobia with needles, as it may trigger a severe panic attack, and if you have a pacemaker, electroacupuncture is not recommended. And you should avoid acupressure if you are experiencing varicose veins, swollen, bruised, or inflamed areas on your body, if you've had a fracture or recent injury, and again, avoiding strong abdominal pressure if you are pregnant. And if you're not sure which one is for you, or if you have a pre-existing condition or mental health concern, please seek the consultation and advice of your mental health therapist, holistic health practitioner, medical provider prior to scheduling any session. So what does a typical session look like? Whether you choose acupuncture or acupressure, you usually can expect on your initial contact to have some sort of intake and consultation, as your practitioner will ask you questions about your symptoms, your medical history, your lifestyle, digestion, sleep patterns, emotions, and stress levels. And they may take your pulse and actually examine your tongue. These are two traditional Chinese medicine diagnostic tools. And then the practitioner will discuss a treatment plan with you, which points they will work with to activate and why. And during the session in acupuncture, the needles are generally inserted for about 15 to 30 minutes, sometimes with heat or an electrical stimulation as applicable. And in acupressure, the practitioner will apply steady pressure, circular motions, and gentle kneading. Both sessions will often induce a deep relaxation. And then finally, integration. You'll feel lighter, calmer, and more grounded afterwards. Some immediately feel relief, and others notice a gradual improvement over several sessions. So how do you find a qualified practitioner? For acupuncture, you will look for a licensed acupuncturist. In the United States, the national organization that certifies practitioners is the National Certification Commission on Acupuncture and Oriental Medicine. And this organization certifies acupuncturists, practitioners working with Chinese herbology, Chinese medicine, and Asian bodywork therapy. And it is often required for licensure in most states. And for acupressure, look for certified practitioners through reputable schools. They have been trained in Chinese medicine theory, not just massage. You can check their level of experience specific to your condition or your objectives. And in either instance, the professional will go over safety protocols with you. Acupuncture and acupressure each offer powerful means of restoring harmony to the body, the mind, and the spirit. Whether you chose the depth of acupuncture or the accessibility of acupressure, both practices encourage your body's natural healing abilities and can serve as profound complements to your overall wellness journey. As we close today, may you carry forward a deeper understanding of these ancient healing arts, recognizing that whether you choose the precision of acupuncture or the touch of acupressure, each modality invites you back into harmony with your own inner landscape, where your true restoration begins. Thank you for sharing time and space today. Namaste. Thanks for tuning in. I hope today's insights help you on a personal journey towards a healthier, happier life. Don't forget to join every Monday, Wednesday, and Saturday at 8 a.m. Eastern for more self-care and holistic wellness tips. Before you go, make sure to comment, click the bell, like, and subscribe buttons for upcoming episode notifications. Be sure to always consult a medical professional before making any major changes regarding your health, diet, or routine. In the meanwhile, stay motivated, stay inspired, and remember, every step you take is one step closer to a better you. Until next time, keep flourishing, and as always, may all be well.